it together and getting it here before the wee hours of July 1st, which is normally when we're signing these pieces of legislation. So thank you, gentlemen. You're welcome to stay, but we're going to move now to our weekly update on COVID-19 pandemic and Delaware's response to it. And with that, we have news today that's not as positive as the budget that we just passed. Over the last couple of weeks, we have experienced an uptick, a resurgence of COVID-19 positive cases in the beach areas specifically. We have seen that in significant testing that has taken place outside of Rehoboth among some of the employers in the beach areas. And significantly, we've seen a shift in the average age of those testing positive to COVID-19 from somewhere in the 40s to 50-year-old demographic to 18 to 25-year-olds. And we'll show a graph of what that looks like. And so clearly, we've had an outbreak among bars, restaurants, social activities in Delaware beaches. We also have witnesses across our state, but in particular in the beach communities, complacency with respect to mask wearing and social distancing. And as a result of this uptick in concern that we see from other states, Texas, Georgia, Florida, California, and many other states, Arizona, across our country, that didn't see the decline in cases that we've seen in Delaware over the last 2 months, but have seen a continuing acceleration. And we don't want to see that here. And in order to stop that, we're not going to move to phase 3 indefinitely. We'll talk a little bit about that. But we want to make sure and get out a message that it's important for every Delawarean to wear a mask when they're in public, in retail establishments, in restaurants, until they're seated and eating, and basically as often as you can, and to limit the trips that you take to the public. So let's go through the data first, which will take us to this surge in cases that we're seeing in eastern Sussex County. Again, as we've been doing on a weekly basis, now we're over 11,000 positive cases. Not a whole lot of new deaths this week, thank God. And our hospitalization rate is lower. And so we'll talk a little bit about that as it relates to the average age of those who are testing positive, but that's a very good sign. We continue to see positive news with respect to hospitalizations. It's an indication of the level of seriousness of the infections that people are experiencing, the sickness that they're experiencing. It also is a function of the fact that the average age has dropped significantly, and a lot of the people testing are not symptomatic, which frankly is problematic in addressing any outbreak that we're seeing. So over 5,000 positive cases in Newcastle County, leading the state once again, although not in the overall intensity there. 16, almost 1,700 cases in Kent County, and 46, almost 4,700 cases, positive cases in Sussex County. Now the next two slides, you kind of have to look at them together, and you see this shift in the average age. These are the number of total cases, and you see that age demographic 18 to 34 is now the largest subsegment of those who've tested positive. If we go to the next slide, you can see where it was prior to more recently, and the average age was 35 to 49. So if you could flip back and forth from those two, you can see the shift and the increase in cases by age in that larger subgroup. So moving on to our data dashboard, all the personal protective equipment, glasses are completely full. We're not experiencing challenges to date. Let's move on to our data board, this is what the 14-day looks like, and you can see where hospitalizations are fairly steady, but declining in terms of new hospital admissions, the second chart in from the top, and that's a good sign, but also a function of the new cases, which is in the next graph on the top right. You can see that increase. The line, the orangish line is the day-to-day number of positives, and the blue bar is the rolling average, 5-day rolling average, and you can see how it is gradually moving upwards. And so the number of persons who are testing positive is increasing over a 14-day period. Remember, our overall guidance from the CDC and NIH was 14 days of improving conditions on all these indicators. We have good 14 days in terms of hospitalizations, and then new positives and the percent positives, which is the chart we were just looking at, I got that backwards, are both moving in the wrong direction. So the top right is percent positives. You can see it moving above, just above 5%. We were doing really well there about 10 days ago when we were around 2.5%, which is kind of where we want to be, to 3 to 4%. And then the new positive cases, the bottom left, you can see gradually moving upward on a 14-day period. If you move over to the 90-day view, you can see, particularly in the very top right, where we've been in terms of percent positive tests, and the little uptick at the bottom. This is in the context of the very steep increase in positive cases that we had back in early April to the peak at the end of April, then a gradual decline in those cases on a day-to-day basis until this really gradual uptake. If you look at the other states that have really experienced dramatic increases, Texas, Florida, Arizona, California, you don't see this peaking and then steady decline and then an uptick at the end. You see a continuing run up to the peak and then an acceleration at the peak. And so we're in a better shape than those, but concerned about the phenomena that we're seeing here in our state since early to mid-June to where we are today, and just a complacency that's that we see mostly in younger folks, particularly those who are enjoying our beaches and the social activities after returning from the beaches and during the days. And so that's of concern, and the reason that we're the main reason that we're going to stay in phase 2, and so that we can really make sure we're stamping down this increase. So we're seeing the increase in positive tests at the beach. Again, here's the graph of the age distribution. The largest bar there is ages 17 and 18, and then you can see from 18 to about 30 is where most of these new positive cases are occurring, and they're occurring mostly at zip codes in the beach area, Rehoboth, Lewis, south of Dewey Beach, and west to about Route 30. And so we're identifying those zip codes as areas where we'll be closing the bars, which I'll talk about in a minute. So we're going to delay phase 3 indefinitely till we get a better handle on where this surge is coming from, and to try to make sure we nip it in the bud so it doesn't turn into a full-blown rebound, trying to, again, protect the most vulnerable populations, which are our seniors populations. So we're going to delay phase 3 across the state and then close the bars indefinitely in those zip codes that I mentioned earlier, effective on Friday, July the 3rd. So we need to encourage, the way we're going to control this surge and this outbreak is by extensive testing identifying contacts that people who test positive have had, and having those people get tested and isolating those so that they're not transmitting the disease from one to another, from people that they live with. Anecdotally, we know that a lot of these young adults in the beach communities live together. They work in similar kinds of establishments. They play together, and they're infecting one another with COVID-19. You know, we had a much more serious outbreak a month or two ago among the workers in our poultry plants, and now we're seeing an outbreak not quite as serious yet in these establishments in our beach communities, and we need to stop it before it reaches more people. And so one of the important ways we're going to do that is to test, and test. So you need to know what your COVID-19 status is. You can help us contain the spread by getting tested. We're encouraging all Delawareans, whether you're symptomatic or not, to get tested. You can find out where the list of the testing sites are on the de.gov/coronavirus website under the bar testing. They have a weekly schedule there. It's helpful if you sign up in advance. It's not required, but we've been testing. We've got at least, I'm told today by A.J. Shaw, who's usually with us at these briefings, 5,000 tests or thereabout that have been done over the last several days, for which we do not have the results yet, but that will provide us with more information on which to base decisions moving forward. So for now, we're staying in phase 2. Phase 2 does involve significant risks in different venues, and we encourage the owners of those establishments and people who would go into to bars and retail establishments to wear a face mask, to wear a face mask when you're in public, to wear a face mask when you're on the boardwalk, to wear a face mask when you're on Rehoboth Avenue shopping, to wear a face mask, mostly in respect for others, to protect them from an infection, a COVID-19 virus that you may be carrying and not knowing it, and therefore shedding it and put other people at risk, as much as to protect others and to protect you. And so wearing a mask, when I look across, and we had our White House conference call earlier this week, and when Dr. Birx and the Vice President talk about the need for everybody to wear masks, when the Governor of Texas and the Governor of California are closing bars in the southern part of California and the whole state of Texas, when the Governor of Florida is doing similar things and pulling back, we know that there's a serious situation out there. It's been brought to all of our attention. We can see it here in small scale in our state of Delaware, and we don't want it to get out of control. Too many people have sacrificed too much for us to see another really dramatic uptick. And the only way that we're going to control that is if people follow the guidance, if people follow the requirements by wearing a face mask when you're in public and when you're a retail establishment, when you go into a restaurant, by being conscious about your 6-foot distance among people that you contact when you're out and about, limiting trips to retail establishments and other folks. When you're out getting exercise, get exercise in the fresh air, but stay away from others. Don't go onto the beach and put your towel or your blanket down right down next to somebody else. We just don't want this to get out of control, and we can stop it. And the virus isn't going to go away. There's no vaccine. There's no way to chase it away. We've got to stamp it down ourselves by our own behavior. And to those who say, well, I don't want to wear a mask anymore, do it for your family members. Do it for your grandparents that you encounter or that you may come in contact with. Do it for your neighbor. That's the way we're going to control the virus. We've got 2 really good examples of how people being in close contact with one another in an employment or a work environment have caused the virus to spread pretty extensively in that community, with our poultry workers and the communities in which they live, and now with our beach establishment workers and the communities in which they live. And so we know what this data, we're going to be driven by the data, and we're going to make it work with your cooperation. And so with that, I'm going to turn it over to Dr. Rattay and thank her and her people at the Division of Public Health for their continued vigilance and attention to this very serious problem, and we look forward, obviously, to your solutions in the days and weeks ahead.
Thank you so much, Governor. So I'm going to start today with talking a little bit about what we know about the beach situation, digging down a little bit more into some of the details. As you all know, we began to talk about the beach situation a couple of weeks ago when we learned of several clusters of cases related to Senior Week, and since then we've actually seen a spike in cases among 17 and 18-year-olds. We also, since that time, have learned of several lifeguards as well as a number of restaurant and bar employees who have become positive. Additionally, our data are clearly showing an increase in cases among residents of the beach community, which often are not the same as those who have visited or who are working in the beach community, but those older, like homeowners, residents in the beach community, are also seeing increases in COVID-19 cases. So, as we have talked about many times, percent positive is a really important indicator for us to look at. We always look at the dashboard, as the governor always shows us, but percent positive is a key indicator, especially when we're doing a lot of testing. If we're doing a lot of testing, which we are, and we see an increase in percent positive, that's concerning. In fact, WHO says, when you're seeing a percent positive above 5, that's a real flag. You need to look very closely at what's going on. So when we look at Newcastle County and we look at Kent County, for the most part, percent positive is flat. It's flat. As the governor shared, for the state of Delaware, percent positive is increasing for the state. And if you look at this chart in the upper right, you see percent positive is increasing in Sussex County. Next slide, please. So some of what we've talked about over and over again is your risk increases the more closely you interact with people. So social distancing, are you less than 6 feet from people? How long are you interacting with people? 10 minutes or more? The number of people you interact with is very important. But then over and over we continue to say how important it is whether or not you're wearing a face covering is directly related to your risk of spreading. And now we know even more from later science whether it increases your risk of getting COVID-19. And of course, being outdoors is safer than being indoors. So you put all these factors together, you clearly see increases in risk. So in the Dewey Beach, Rehoboth zip code area 19971, the chart on the left clearly shows an increase, a significant increase in percent positive cases in this zip code recently. And if you look at the chart on the right, you see a spike of cases. And again, these are really residents in the community. From testing events, we're seeing even many more positive cases. Again, many of those positive cases are people who are living down there, but don't include the beach area as their permanent residence. Last Thursday, at a testing event where over 1,000 people were tested, 102 of those were positive, which is a 9.5% positivity. That average age was 29, but ranged between 17 and 72. We also did another smaller event on Friday, next slide, please, of restaurant employees, and among those tested, 93 tested, 12 were positive cases, which was a 14.8% positivity. And again, these were younger individuals, and most all of them were either just mildly with symptoms or didn't have symptoms at all, which is common for young adults or kids who are positive for COVID-19. So in sum, from our findings, from our case investigations, as well as the data, and also from the many pictures and observations that we've all been making, social distancing and lack of face coverings on the beach is certainly problematic. And although face coverings are only recommended on the beach, you really need to be wearing a face covering if you're not at least 6 feet away from people who are not in your household. We've seen numerous situations, numerous pictures of restaurant servers without face coverings, as well as numerous pictures of individuals on the boardwalk without face coverings or not social distancing. And from our interviews and discussions with summer staff, they certainly work with one another, live with one another, and socialize in bars and in other areas with large numbers of other young adults. And many of these individuals also, or I should say some of these individuals, also live with older relatives, which is of concern. So testing is key for us getting on top of this and really understanding the incidence of COVID-19 in the beach area right now. We know we have a problem, but the more testing we can do, the better we can understand it. Also, the better we can isolate those who are positive and quarantine those who are contacts. So there was a testing event yesterday. Thank you to the Starboard for hosting this testing event where over 1,300 individuals were tested. There's one on Wednesday with in collaboration between BB and the Restaurant Association, but it's also open to the public. There's an additional one on Thursday in Rehoboth at the Epworth United Methodist Church. As always, go to de.gov/get-tested to get more information about these testing locations. If you were at the beach and you're now upstate or elsewhere in the state, please strongly consider getting tested. But certainly anybody who works at the beach or has been frequenting bars or restaurants at the beach, or who lives with individuals who are not your family members, especially in a congregate living situation, please get tested. I want to say something positive, which is there's a lot of restaurants and bars who are really trying hard to do the right thing. I want to give a shout out to the Starboard, as well as the Purple Parrot, the Paradise Grill, and Woody's, who have all been observed to be taking some great measures to either close if they become concerned, getting their staff tested, and really just doing the right thing. It is hard for these establishments to control these crowds and to get people to do the right thing, quite frankly. So it's up to everybody to do the right things in social distancing and wearing face coverings. So as we mentioned last week, we are really stepping up enforcement actions. And always our first step in DPH is to provide information and education. We want to help people to do the right thing, but depending on the situation, inspections or follow-up inspections will take place. As far as punitive actions, certain establishments may be reverted to phase 1 restrictions. Fines may come into play, which would be $1,000 for each violation. So for example, if you have 5 staff who are not wearing face coverings, that could be $5,000. Closure could take place, or referral to law enforcement, depending on the circumstances. So again, this is really important. We need eyes and ears out there. If you see places or situations that are of concern, please email us at hsbcontact@delaware.gov, and we will follow up with those complaints. I want to shift gears quickly to our contact tracing program. You've heard us talk quite a bit about the partnership that we have with NORC, Innovational, and HMA. This has been an enormous effort to stand up this new IT system, as well as to hire new individuals to be contact tracers. At this time, 150 telephone contact tracers have been hired by NORC. 78% of those are Delawareans, and that will increase over time. And 38 of those are from our opportunity community zones or our more vulnerable communities, and we want to see that number increase over time. We are looking to hire 42 field tracers in public health. We have already hired 13, and those are folks who will be on the ground to talk with either cases or their contacts where there's no phone number. Hiring is ongoing, so we want to encourage people to come to our website and apply if you're interested in any of these positions. And I also just want to say we have had a successful database transition from RedCap to Salesforce. It's been an incredibly complex migration and building of multiple IT systems. We're just so grateful to the many smart people who successfully made this happen. So bottom line is, please help us trace the virus. If you get a call from us, either as a case or a potential contact, please talk to us. Please help us have the information that we need. And if you are asked to isolate or quarantine, please help us by doing the right thing, protecting yourself and others. And I'm going to close with an Instagram post that my daughter found yesterday. For those Grey's Anatomy fans out there, or Dr. McDreamy followers, you may know that before he would do surgeries, he would say it's a beautiful day to save lives. And so he posted this yesterday, Patrick Dempsey, really encouraging people to wear a face covering. And I think that's much more powerful than I can say it. So thank you, Patrick Dempsey, and to all of our Delawareans out there, please heed his advice.
Thank you, Dr. Rattay. It is a good day to save lives, and all of us can be part of that. When I was Lieutenant Governor, each October in Fire Prevention Week, we used to have a campaign to get Delaware residents to install smoke alarms so that they can detect fires in their house. We have a little bit of a fire that's been started in the beach communities here in Delaware with COVID-19, and we need to put it out. And the only way to put it out is for all of us to come together to get tested, to make sure that we wear a face covering, that we maintain social distancing, particularly when we're in public, and in places where it's more difficult to maintain social distancing, make sure that the mask is on. Everybody can do their part. That campaign was called Wake Up Delaware. And this ought to be a wake-up call for all of us, as we've seen this outburst in eastern Sussex County, to make sure that we stamp it out, that we put out the fire before it starts and spreads, and that we take advantage of all the sacrifices that people have made over the last 3 months. I don't want to be like those other states that were reported on in the White House call earlier this week, and we can stop it if we follow the rules, wear a face mask, and observe appropriate social distancing. I want to thank Director Jackson again, and the co-chairs of the Joint Finance Committee for their incredibly important and difficult work during this pandemic season. We've got our budget, our bond bill, and our grant and aid bill signed prior to 5 o'clock on June 30th, and that's a positive thing in any year. I'm really confident that we can come together as Delawareans and stop the spread of this virus, and for everybody to be responsible particularly when they're in public. And so with that, I want to thank the media for coming again today and for your questions, some of which have been submitted in advance. Please, Meredith.
Hello. Governor, other states have put restrictions on the beaches, either closing them or travel restrictions, as well as indoor dining limitations or pausing it completely. Considering what you're seeing in Sussex County, are you considering doing the same this week before the holiday?
Yeah, no, we thought the most effective thing to do would be to hold into phase 2. We need to really, I think, approach enforcement a little bit more aggressively, at least in as I understand it, this issue was identified by complaints that we received about behavior that was just inappropriate. We had heard it from the owners of the establishments who had taken action on their own part. And by the way, they've acted very responsibly and in shutting down earlier and shutting down completely to get all their workers tested. I think they get it that, they were shut down for a significant period of time, that if it gets a lot worse, then we might end up there. And so right now we want to manage it with extensive testing and contact tracing and isolation, and really emphasizing the need to follow the guidance with respect to the requirements with respect to mask wearing and social distancing.
And with contact tracing, some states have reported difficulty, and Dr. Fauci said it wasn't going well, I believe, last week or so. How is it going in Delaware, and has there been a difficulty in getting in touch with people or finding the path of where the virus is spreading?
Yeah, I'm going to turn it over to Dr. Rattay after just making some general comments, and that is, I think every state's learning. We have a great partner, which we just kind of finalized that agreement with. We were standing up our program with the Delaware Army and Air National Guard, and they did a really nice job, kind of under difficult circumstances. I mean, one of the things that we want to make sure we're getting from this information is where people have been, not just who they were with, so that we have a sense as to where to look for outbreaks. And so I think it is a work in progress. I'm pleased with. We got over a big technical IT hurdle recently, and I think that's a very positive sign. Dr. Rattay?
Yeah, in Delaware, we are doing a little better than some places. We have approximately 66% of cases and contacts who are able to be reached and connect with us. And so, but there are some, for whatever reason, that we are unable to connect with. And this really does emphasize why it is important to do the field tracing work, because there, a lot of people don't have all the information about their contacts. They might know it's Joe, but they might not know, all of the information about Joe. So to be able to have other individuals who are looking more closely and maybe going to Joe's house, even though, they don't know his last name, that can help us to really enhance our outreach and connection efforts. So again, we're grateful for the help with the National Guard. We've been contact tracing everyone since May 15th. And but we're also now excited about the NORC, our more permanent workforce, that's going to help us over the upcoming year, and the experience that they're already showing that they're gaining in doing this work.
One of the concerns, again, particularly with certain activities that bring people from other states, is making sure you have the information about those people at an event, so that if you have a COVID-19 situation, that you can actually contact them. And sometimes it's hard for those event or organizers to understand why that's important, but it is important from that perspective.
Governor, last week you spoke about the need, and actually today, you spoke about the need to move a bit from education to enforcement in terms of some restaurant and business inspections. I'm wondering, though, with the cluster of new cases and some of the frustrations I'm hearing from business owners about we're doing everything right, but we can't control the general public, Are you considering stepping up enforcement of the general public, whether that's, citing people for not wearing masks in public where they're required to, or anything of that sort?
Yeah, well, yeah, is the answer. I think we have a better chance with, business owners, restaurant owners can't just say, I can't control anybody without doing anything,
Right.
I know even the establishment that has been named here in the Starboard, and they've been responsible in closing for testing and all that. Even, prior to that, when you went in, they'd have a squirt of sanitizer. You'd have to have a mask on before you went in. When you sat down, not so much. But I think a lot of this is the interaction among staff, kind of at work and off of work.
Mm-hmm.
And that's really a challenging part, right? That goes to, parties that are in private, homes or whatever, that you really don't have much control over, particularly now since we don't limit, unless it's a really big party, we don't limit an indoor gathering like that in terms of numbers, where we did at one point. So we're going to work on, enforcement with respect to the establishments and signage and communication, trying to figure out, put ourselves in the mind of an 18 to 25-year-old. That might be hard to do.
Right.
I was one once, but it's a long time ago. And we've thought about that. We don't want to create unintended consequences, right? Because we know there are certain things that they're going to do regardless. And so I think we need to be smart about it.
And then this past week in some interviews, your new health secretary said that she's not necessarily in favor of perhaps bringing back a total shutdown of the economy if it's needed, months down the line. I'm wondering if that's a view you share, or if things continue on this path, if that's something you'd have to consider.
Yeah, I think we got a big team.
Right.
And I think appropriately, we have members of the team that are more conservative than others and have a greater focus on the public health side of it, the strict science side of it. And then there's a continuing, then maybe on the other side, the folks that we have on our team that, interact with the business sector more directly, and they're trying to translate the science into practice and practical, a use of the science in a way that enables businesses that can be successful and operate, but in a safe way. No business person wants to operate unsafely. I'm convinced of that. And I know it's a problem, as they say. We had one establishment who decided to close at 8 o'clock or whatever, so that they didn't get to that uncontrollable 10 or 11 o'clock crowd. So yeah, we have a broad team. I think everybody understands the overall objective, which is to find some middle ground where we can have a healthy community and a healthy economy, as I said time and time again. There's a lot of tension, though, among the different players. I think our new secretary has a good sense of balance. She and I are certainly familiar with debating with one another about different things and are comfortable with that. I have every confidence that she has the health and welfare of every Delawarean uppermost in her mind.
This first question's from Susan Canfora at Coastal Point. Local business owners at the beach in Lower Sussex County are very concerned not only about financial losses due to closings in the wake of coronavirus, but also about J1 students not being permitted to come to work this summer. Will the state be offering any additional financial help that hasn't already been announced for these businesses in the form of grants or loans?
Yeah, so we are in the process of putting together another assistance program, as I understand it. I think the details are coming out later today or later this week. I know that the employee issue is a big one. When you have employees who test positive, they have to kind of go on the bench for a number of days, and so they're out of, they can't come to work. When you have people that have identified and under certain conditions of exposure that are also, required to isolate, or at least encouraged to isolate, so that takes somebody else out. So I know that employers, and they've said so publicly in the media this week, are concerned about having employees to provide the service that they need, and some have closed because they weren't able to get employees. Remember, employees have to be comfortable that it's safe to go to work, and we saw that firsthand with the poultry industry outbreak that we had, where once actually we got in there and were testing, people felt more comfortable about coming to work because people knew who was positive and who wasn't. When we were in testing in their neighborhoods, similarly, it helped create a comfort level there, even though I think the companies were hesitant because they didn't want to be without workers. People need to be smart about the balance here. You can't sacrifice, a worker who's sick in order, because you need somebody to do the job, right? Because that person's going to infect somebody else, and it's just going to get worse. That's the kind of message that we're trying to drive home.
We have several questions about the rally tonight at the Dover Mall. Are there any plans to shut back down, or what is your message to the people who are planning to demonstrate over the issue of shutdown?
Well, I listen to the people who demonstrate. Obviously, this information kind of makes our case, and I think it doesn't support their view of the world. They have the right to protest. We are not closing down. We're staying in phase 2. If you look at the things that are allowed in phase 2, it's significantly open in phase 2, and differently than states around us, which does cause me concern, with respect to the differences between here and, New Jersey and New York. I guess Pennsylvania and Maryland are, open to a certain degree on the restaurant. It really comes down to these places where people congregate: restaurants, bars, group activities, youth activities in a tournament setting or in a group setting. And that's where we're trying to focus our attention, and that's where we'll try to focus our enforcement to make sure that people are following the guidelines, because they're risky. We could shut everything down, then our economy would fall apart, and that's not that doesn't make a lot of sense. Now, there are certain areas that just are more risky than others that we have to pay a lot more attention to.
This next question is from Tom Lehman at WBOC. This question is for Dr. Rattay. Some critics of DPH, including those protesting tonight, have argued the state's response to coronavirus is too overbearing and the threat has been overestimated. What would you tell them today?
Can I interrupt for a minute and answer that question? Put the graph up there of the 90-day. No, the 90-day for overall. Yeah, top right. To me, that's Exhibit 1, right? That shows what we did, what we responded to at its peak. It's almost classic. I'm not an epidemiologist and haven't been to public health school, but I think if you talked about a pandemic, that's the graph that you would see. Now look at the far right. That's not supposed to be there. That's what we're trying to stamp down. Now, if you look at a similar diagram in Arizona, Texas, Florida, and whatever, it won't look like that. You won't see the decline that we've seen. And I think that's kind of the point. The point is, we did what we had to do. And we pushed that curve down. Let's not lose all that effort by allowing this blip at the end to continue to rise. Sorry, Dr. Rattay, I wanted to
No, it's great.
make my case there.
I mean, this is a pandemic. This is something that none of us have ever experienced in our lifetimes. And we have lost 507 Delawareans in a short amount of time. 507 deaths in our state from this virus is devastating. And experts predict that a future wave has the potential to be so much worse, especially in the midst of influenza season. So I would argue that in the midst of this pandemic, we are doing everything to allow people freedom, to allow people a sense of normalcy, and trying to do it as safely as possible. We talk a lot about the most important things being face coverings and social distancing. Face coverings and social distancing gives us the freedom to be able to live something like a normal life during this pandemic. But as we've seen in the bar scene, or the beach scene, the beach bar scene, and elsewhere, people aren't taking this guidance as they should be. So we have to do everything we can to prevent that next wave from devastating us even more and Delawareans losing even more lives.
This next question from Sean Green at WDEL is also for Dr. Atay. What is the latest research into the high-risk contact sports? What are you hoping to see as the NFL and college football begin shaping their fall plans?
Yeah, so that's a tough one. We've talked a bit about this with sports. You know, contact sports are very risky, and as we have seen, there's a lot of certainly college athletes who have tested positive recently, and so we certainly do not have all the answers, certainly for high school sports at this point. But we are pleased that we've been able to move forward with some youth sports. But I will say we also have some concerns about people's behaviors at those kinds of events as well. So, you know, this is learning. We are learning and evolving. But as far as college sports and pro sports, specifically contact sports, we just don't have all the answers right now.
Well, I played college football, so I know a little bit about it, and I don't know how you played in the pandemic kind of sense. I mean, think about the huddle itself. And practicing, and the fans. It's just hard to imagine you can accomplish the objectives of social distancing and appropriate protection. Now you could, you know, they wear the shields now, and you could do that, which would be helpful. Mike coaches, he knows. I mean, it's a hard thing to do, particularly hard for the 7 people down on the line of scrimmage. I just don't. And my nephew is one of those guys for the Minnesota Vikings, and I don't know how that kind of thing can happen.
All right, we have time for one more question. This question's from Amy Cherry at WDEL. Governor, what is your reaction to the whipping post being removed in Georgetown tomorrow?
Yeah, I think it was the right thing to do. I mean, the idea that at some point in our history, we took individuals out to the public square and whipped them like that. And then, of course, those who were enslaved Delawareans here in our state were whipped when they were, you know, on the farms and plantations in our state outside of the law. And I think for Delawareans of African descent, descendants of slaves, I think it's a terrible reminder of that history. And so I think appropriate to put it in a museum or a place out of the public square. All right, so Director Jackson, thank you again for the work we did. It's June 30th. We have our budget, we have our bond bill, we have our grant and aid bill, we have the revenue resolutions that establish it, and it was a very productive year in that respect. We thought things were going to be a lot worse. They could have been a lot worse. It could have been disastrous. We've been able to pass a budget where nobody lost their jobs, with no tax increases. We maintained our commitments to our schools, both on the operating and capital basis, to investments in communities, and did that, I think, because of the responsible way that you and your team and our friends in the legislature worked over the last 3 years. We've come into a bit of a crossroads here on the pandemic trajectory. If I think about going back to early March when our first case was discovered and where we've been since, there's been a lot of pain and sacrifice, mostly from businesses that were forced to close. And we did great. And I look at the 90-day view in retrospect, and I see the climb and acceleration of those positive cases. And I know that with each of those positive cases, in each of those days went by, that we had a number of Delawareans who lost their lives from the virus. Over 500 now, 507 I think to be exact, everyone a precious life, and we worried as the cases increased whether we would have the hospital capacity to deal with the surge and those who were critically ill. And we, in the end, learned that we had plenty of hospital capacity. Our hospitalization rate at the peak was about 337, I think on April the 27th. And since then, it's been declining. 337 is just a little bit over halfway to what we estimated our capacity to be, and so we met that challenge. Delawareans came together, they stayed at home, they worked from home, they were cautious when they went out into the public. We shut down beaches and bars and restaurants for weeks on end, and you can see what the result was, that the number of cases went down, the percent positive cases as we ramped up testing significantly. And A.J. Shaw, who's usually with us here, has done a tremendous job as the point person working with the doctors, Rick, in the Division of Public Health to stand up testing 2 or 3 times, 4 times what it was in the early weeks there. And so now we've hit a bump in the road, and it's really time for all of us to roll up our sleeves and to do what we have to do, whether it's wearing a mask, limiting our interaction, public interaction, make sure we're maintaining social distancing, taking care of our senior citizens and vulnerable Delawareans, and we're doing a much better job. We're way better prepared today than we were in March the 15th to address whatever comes at us. And I'm confident that Delawareans will seize the day and seize the moment and do what we have to do. Just put out that little fire there at the far right of that 90-day view of the COVID-19 pandemic here in our state, and not be like the other states across the country. If we don't, if we get complacent, if we listen to the naysayers, then we're going to end up like some of those other states. I don't want to be in that place, and I know Delawareans across our state don't want to be in that place. And so we need your help, and I'm confident that we'll get it. And so with that, we'll see you next week.